fellowship track, where she matched it into a fellowship at University of California, San Diego. So in 2021, I left my practice and began locums work while she was out there. I mainly worked in southern Idaho, where me and a friend of mine provided basically full-time coverage for a urology department in southern Idaho. And I did that up until October 24th, 2022, when my first child was born. That was towards the end of my wife's fellowship. So I stepped aside to take care of him and get us kind of moved into wherever our next step was, which turned out to be Memphis. My wife took a position in 2025 at University of Tennessee, Memphis branch as a professor there. And she's been there since. To make a long story short, we've had a lot of difficulties getting a lot of health problems and difficulties with our first child. And we came to find out he was born with Fragile X syndrome. So I've been kind of his primary caregiver as he's sort of failed multiple daycares and private school options for us. He's 3 years old now, and he's just recently become enrolled in a individual education program where he's at school 5 days a week now, and kind of an environment that's suited for him. So I'm trying to work my way back into kind of a reentry path. I've been given a conditional license by University of Tennessee, or by, I'm sorry, the state of Tennessee's medical board, which involves a preceptorship plan. I've signed a letter of intent with a local urology group called Conrad Pearson, and I have a senior partner who's agreed to be my preceptor. We have a plan laid out kind of for how to integrate me back in, and I can provide those if that would help. So I suppose I'm looking for a re-entry path because I will be practicing at South Haven branch for the group that I've joined. I know it's kind of an abnormal story, but thank you for letting me share some of the details of kind of what's put me aside, and I'm happy to answer any questions about that if I can.
Thank you, Dr. Wallin. So when is the last day that you actually worked as a urologist?
It was basically the day my son was born, October 24th, 2022. I was coming back from a shift, basically when my wife went into labor.
And so could you tell me, the nature of your practice at that time? Was that surgery and office and everything, or what?
Yeah. Yes, sir. I'm a general urologist, so I do primarily endoscopic surgery and clinic procedures and run a busy clinic and provide call coverage as well.
And you mentioned a reentry program with your prospective employer. Could you tell us about that?
Well, that's been dictated through Tennessee's medical board. They are requiring basically 6 months of both direct and indirect oversight from a senior partner. So my license is conditional on satisfying that. There's kind of regular check-ins and notices for them, kind of updating them on how I'm doing.
So you're working in Tennessee and Mississippi?
Not yet, actually. So the way we found out my son has Fragile X syndrome is my wife was having fertility issues. Found out she was in premature ovarian failure as a carrier for Fragile X. And we unexpectedly ended up having a child, another child. So actually, I'm here caring for a 3-month-old, as well as my toddler right now. So I have not gone back to work yet.
So when would you like to return to work?
It's looking like probably in the fall. And my son is back to school, and we have our daughter in childcare.
Okay. So even though it's been a little bit over 3 years, like what it's been like 3.5 years since you worked,
Yes,
but
sir.
it's looking like it's going to be like 4 years before you start back this fall, maybe. So, but you
Most
but
likely. Yeah.
you have a reentry program dictated by the medical board in Tennessee, and will that also apply to your practice in South Haven, Mississippi?
Not that I'm aware of. That's just the conditions for me to earn a full Tennessee license, is my understanding.
Okay.
And there are individual requirements at the hospitals I'm working at, just as far as how they would expect me to be integrated back into surgery. It essentially is less stringent than the Tennessee requirements. So it's just involves a preceptor once again to observe how I'm doing with procedures for the first, I want to say 3 months or so. That is the most stringent of the hospitals that I'll be at.
So, is this your first application for a Mississippi medical license?
Yes, sir.
You've not had a Mississippi license before, is that correct?
No, sir.
Okay. Okay. Um, 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 Dr. Givens, do you have any questions for Dr.
Yeah, I think just one question, as far as continuing education, during your time away, have you maintained, those hours and at least, um, whether in person or remotely, uh, engaged in any educational activities for credit?
Yes, I have kept up with my CME. I've also kept up with the American Board of Urology's. They use a continuing certification process. So every year there's some additional activity I have to do with them, and I'm up to date on that. I'm also married to a urologist who's still practicing. So we discuss a lot of cases, and I'm active with a group of friends who are all urologists. I've been kind of really trying to get this thing going for probably 2+ years now. It's just had just failure to launch in terms of having something stable enough with my child to get back into a practice role.
Okay. Anything else, Dr. Givens?
No, that's all I have. Thank you.
Thank you. Dr. Owens, do you have any questions?
No, I think Dr. Givens touched on what I was going to ask, which was about board certification and maintenance of or continuing certification, and that's been answered. But I will also say go Blazers.
Go Blazers.
Who's there?
Hey,
Okay.
buddy.
Okay. So, um,
Quiet down.
so, if do we have any other questions or discussions, Dr. Owens, Dr. Givens?
So I guess I'd like to move for us to move to close the meeting to consider whether to go into executive session for discussion on this matter.
Second.
We have a motion and a second to close the meeting. All in favor, say aye.
Aye.
Meeting is closed to consider whether to go into executive session on this matter.
Lars there.
now back in open session, and I'd like to ask Dr. Givens, our secretary, to give the committee's decision.
Yeah, good morning. Thank you. The executive committee met regarding the request by Dr. Lars Wallin regarding exemption from the requirements. Mississippi Code Part 2601, Chapter 1, Rule 1.3. The executive committee decided to table the request. Dr. Wallin is asked to contact the executive director to develop a board-approved reentry program that could then be considered by the board.
Thank you, Dr. Givens, and thank you, Dr. Wallin.
Thank you. Appreciate you guys doing this on Zoom. It's kind of helped me take care of my kids while we did it.
Awesome. Good luck to you.
Thank you very much.
The next item on our agenda is Dr. Oscar Jameson Stokes, MD, applicant. Dr. Stokes, are you with us?
Yes, I'm here. Can you hear me?
Yes.
Yes.
Okay.
Yes. 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 Yeah. Please just tell us how you hope we might be able to help you this morning, Dr. Stokes.
Yes, I'm seeking a medical license in the state of Mississippi. I made application over a year. It's been a while, and applied because I'm looking to move closer to family that we also have in Mississippi. We've been planning to leave Georgia for the last few years. I'm sure a lot of you had a chance to read through my application, so I can provide as much or more information as you need to, but a brief summary. Looking for a license in Mississippi. Right now, I have an unrestricted license in Missouri. Right now, because we're located in Georgia and my wife is a pediatrician working here, she also is looking to move. We're looking to move to Mississippi, northern Mississippi. We have family in Natchez. We had horrible legal troubles related to my practice when I had a pain management practice. This was back in 2013 and 2014. It was a very difficult time, but I grew a lot from it. The good thing is that I was able to learn a lot, and it was a growing opportunity. A lot of urine drug testing that I did, I missed a lot of things that I now know that caused a lot of harm for my family, and my kids, my wife, and my patients. And I missed in my community. And we've been trying to leave here for years, just have not found the ideal opportunity. We made application in Mississippi. I was asked to provide a specs exam, which I took, and I passed the specs exam. I also have done a couple of things since I've done quite a few reentry processes, formal ones, very intensive program in Mount Sinai Hospital in New York. Also, I did an intensive clinical reentry assessment program at the University of Colorado in Denver. I also did a program at University of Alabama in Birmingham, and also have worked on numerous CME projects over the last few years. Currently, I'm at Piedmont Henry Hospital in Stockbridge, Georgia. I'm working under 3 physicians there on a daily basis. I'm there during days. We're rotating through the SICU as well as the operative units. And there I'm able to I've been there for nearly a year now. And I've been able to just day to day, I'm with them all day, and I'm just ready to move forward. In addition, on the weekends, I work with preventative medicine clinic. We've been working in Stone Mountain, Georgia, helping out there, and I'm doing exams for them. My children are both remote learners now, and we are anticipating a move from the state, and we're just looking for the opportunity to get to Mississippi. And we've been waiting quite a while to just try to make some progression forward. In the spirit of transparency, we have had some job opportunities in other locations. The problem was just kind of getting my wife also to have opportunity. Family member that we were moving, that was the draw for us applying for a Missouri state licensure some years back. He died over half a year ago. And a lot of the family that were there, we just don't have a purpose to move there. And it's just hard to go back and forth logistically to work. We're just looking for something closer to Georgia, where I have some family connection where we could look to plant roots. And that's my reasoning for applying to Mississippi.
Thank you, Dr. Stokes. So you said that you're living in Missouri now, is that correct?
No, we're living in Atlanta. We're living in north of Atlanta, Alpharetta, Georgia.
Could you tell me the nature, the exact nature of your current practice?
Yes, I'm at Piedmont Henry Hospital. It's a small, well, no, we have about, it's a pretty good sized hospital, serving the area just south of Atlanta. Daily management of complex perioperative cases. I'm shadowing. It's more of a observership, and I've been there. We also go through the SICU units, the PACU units, and into the ORs. One of my letters of recommendation is from, well, two of the letters are from doctors who I'm currently working with there now most of the days.
Do you have an unrestricted license in Georgia?
No, that was where I was initially licensed. We are looking to leave Georgia. We don't want to stay in Georgia. We've been looking to leave. The practice location where I had a practice in 2013, we don't live far from here. And we're having to drive past that location almost daily for work. And it is traumatic for all of us. And we've been trying to leave for quite a while now.
So are you practicing general anesthesiology now?
That's my goal, to practice general anesthesia. No,
Well,
right now I've just been gaining daily experience, gaining confidence. I've been doing these reentry programs, gaining daily experience. I've been in this reentry process for several years now. And right now I'm just looking to get a practice location where both my wife can have practice opportunity and I can set down roots. My children are stable and we can get to work.
You're hoping to practice general anesthesiology, is that correct?
That's right.
When is the last time you practiced general anesthesiology?
Independently, just with no one else in the room. That was 1999 at Caraway in Birmingham, Alabama.
Okay.
Since then, it's always been in a reentry, or it's been in an observership atmosphere, or with me in a reentry program in these various states I've been. And I've been at that for several years now.
So do you have a job opportunity in Mississippi?
Well, we've had a couple through recruiters, but like I said, it has been an extended period through the application process. We had to kind of submit documents and wait, and things change in that atmosphere. They'll get other applicants. We'll interview with places and have imminent job opportunities, but we have to have licensure. That is and it has, it would be for my wife and I. We'd want to move forward together, of course.
Okay.
So I've got a question. So I'm looking here. I see I guess a CPEP completed. Is that January? in 2024, 2025. So you completed CPEP, and that was
Yes,
for anesthesia and anesthesiology.
that's right. CPEP was for anesthesiology. It was it was an anesthesiology reentry and reassessment. That was through the University of Colorado in Denver.
Okay, so you completed that in 2025.
January of 2025.
Okay, so you completed that, and your clinical exposure, following completion of that program has been what? If you can explain that to me from 25 on that.
Mount Sinai Hospital was the one you should have also from in New York, New York. That was September of 2025. My clinical exposure at Piedmont Hospital was also in 2025 as well, June of 2025. I started with them, and I've been taking case logs of my day-to-day cases with them, and I'm still doing it. We're doing anywhere from 3 to 5 cases a day at Piedmont Henry, shoulder arthroplasties. We're doing regional blocks. I'm in an assisting role. I mean, there's a little that I'm able to just do at a hospital where I'm not staying in Georgia, but it's just being around them every day. And I'm in the ORs. So I'm able to, we're doing a lot of ortho. They have a lot of ortho there, strong OB department, colonoscopies, EGDs, upper lower endoscopies. They even have some at Mount Sinai, I was able to do more transplant and more complex cases because that was a larger academic facility. But at Piedmont Henry, I'm seeing more bread and butter cases. And I've just been at it quite a while, and I'm just ready to move forward.
Okay, and so my next question is so now, do you have application for any other states? So I'm just trying to figure out, are you like in a sort of reentry where you've applied to a particular state that is laid out, here are the steps that you'll need? Is that with Mississippi only, or do you have some,
Right.
any other state that you're already contacted and they said, here are the steps that you need to go through?
Yes. In Missouri, I had to have the assessment done. After the assessment, they, sent in my results, and I have an unrestricted license from there, and that was the requirement for Missouri. For Tennessee, Tennessee wanted me to have a situation there like I do at Piedmont Henry Hospital in the state. And the problem was logistically, we don't have a connection in Tennessee, and my wife didn't find a practice opportunity that she was going to accept in Tennessee. She's in private practice with a small group. But they wanted me to have a hospital, a physician, and pretty much do a rotating observership, like I am at Piedmont Henry, but in the state. And that, of course, it just hasn't come to fruition just because of logistics. Because I pretty much be staying there, and I'd just be there for the purpose, but I wouldn't be able to do anything else with family.
Okay. So so you said you have an unrestricted license in which state?
Missouri.
Missouri, and Tennessee is requiring some additional items.
Right.
Okay, gotcha. Okay.
And I have their letter in here. They sent me this was quite a while ago. Well, it was, but they sent me a letter saying, hey, this is the situation that they wanted. And I let them know that about Piedmont Henry, and they knew exactly who I was rotating with. And I don't think my wife didn't make application to Tennessee. So we're kind of in a holding pattern. And plus at the time I made application here before I did there. It was just this took, it's been a process. It's been a while since I made initial application. But I applied in Mississippi quite a while ago. So it was right after we've just been kind of waiting.
Okay, gotcha. Okay, all right, thanks. That's all I had.
Thank you, Dr. Givens. Excuse me, Dr. Owens.
Hi, Dr. Stokes. A couple of things. So first, can you just give me a brief overview of your education and training? I know you had submitted that information to us, but I just want to make sure that I'm clear. And when I say your education and training, I'm talking about what brought you into the practice of medicine. So medical school, residency, any fellowship training that you received.
Sure. Yes, I completed medical school at Morehouse School of Medicine in Atlanta. Before then, well, college at Dillard University in New Orleans. I also did a master's degree, a master's of science in biology at the State University of West Georgia. I have a second master's degree in MBA through Taft University. I entered medical education, Morehouse School of Medicine in Atlanta, Georgia. Afterward, I did anesthesiology residency at Cedars-Sinai Medical Center in Los Angeles, California. I was also chief resident of that program that year. I went on after there to do a fellowship in pain medicine at Stanford University in Palo Alto, California. After that, I stayed on faculty at University of California, Irvine, where I was clinical assistant professor in the Department of Anesthesia and the Division of Pain Medicine. And I've worked other jobs since then as well.
Okay. And so, so at what year did you complete like your fellowship? What was the end of your medical training?
2008.
So you finished in 2008. When Dr. Lippincott asked you about when was the last time that you practiced independently as an anesthesiologist, you said 1999.
I'm
And
sorry, 2019. I'm
okay,
sorry.
because
Yes, I'm sorry,
like
2019.
1999 was a very long time ago. It was a good year though, a very long time ago. Okay, so it wasn't 1999.
No, ma'am, I'm sorry.
Okay, so it was in 2019. Now you said at Caraway Hospital.
Yes, ma'am.
You're talking to a girl from Birmingham, so I actually know where Caraway is. And was
Yes.
that and that was so, but it was in Caraway in
Yes,
2019. Okay.
that's right.
Because
Caraway Hospital.
I was about to ask you about, because you talked about 2013 at 2013 time, but I was going to ask you about the 1999 to 2019 time and to reconcile the difference between the completion of your training and 1999 just threw me off. I've been fixated on that since you said it. So thanks for that clarification. So the last time you practiced independently as an anesthesiologist was in 2019, and that was
Yes,
in Birmingham at Caraway Methodist Hospital.
that's right.
Okay. And at the time in 2019, when you were practicing, was your practice entirely
Sorry. I'm sorry, there was something else too. I wanted to make sure. I think I'm kind of so I was at Caraway in a PGY one of my surgical training. So Caraway is closed since then. Caraway Hospital in Birmingham is closed.
Yeah.
Now, I was at Crestwood in Huntsville. Crestwood is where the last place where I practiced anesthesia in 2019. Caraway was my surgery year before anesthesia training. That was that was right before anesthesia training, and that's in Birmingham.
Yeah, that was going to be my next question because I also
Okay, I'm sorry. Yeah, I think I was misspeaking. I'm very sorry. Yeah, the
no worries.
C's, and I think I gave the wrong one.
That's all right. So it was actually Crestwood in Huntsville.
Yes, ma'am.
Okay, gotcha.
And Caraway is in well, you're from Caraway in Birmingham. Yeah.
All right. So When you last practiced independently as an anesthesiologist, what did your practice entail? Was it general anesthesia? Was it in your fellowship in pain management? What exactly was your practice like when you were last practicing as an independent anesthesiologist?
Both. Both. I would do general anesthesia in the ORs, call, OB, epidurals, and also I would see more so acute or chronic pain cases.
So did you have like clinic time where you were doing pain management and then you were also doing general anesthesia like as your hospital-based component of your practice? Is that kind of
Yes.
what you were doing? Okay. Gotcha. Um, and so just to clarify, because I understand that the challenge of presenting in front of this group and similar groups, that I just understand how difficult it can sometimes be to kind of talk through some of these things. But I just want to clarify. So Dr. Lippincott asked you earlier about jobs that have been identified or if there were any potential job opportunities within Mississippi. And so and I'm happy to let you elaborate afterwards, but if you could just yes or no, whether or not there's been a place within Mississippi. I know you said you guys are considering coming here. You got family here. We need practitioners in Mississippi, especially pediatricians too. No offense to the anesthesiologist in the room, but we need them too. But do you? So I guess have you researched or made application because some people will reach out to facilities or places that are potential practices and say, hey, I'm considering coming. And people will say, hey, we'd love to have you. Just get your license. And if you can get a license, then we'd be happy to bring you on. My question is, do you or have you had an offer like that, or have you had that kind of exchange with any facilities in Mississippi? You don't have to tell me who they are, but just have you done that?
Yes.
Okay.
Yes, and and there have been opportunities that are there for both of us close to where family live. And um the process just takes time. And then over time you lose connection or contact with who you were originally speaking with. But yes, and I would love an opportunity to come there and practice. Um,
All right. Thank you. I think that is all that I have for now.
Dr. Cleveland?
Thank you. Dr. Stokes, did you apply for reinstatement to get a license back in the state of Georgia?
as soon as the first day I could possibly apply, I did. I had my lawyer reach out to the state medical board, the contact he had. He said, yes, you can go before them and reapply. This was like in 2022. And he said that no, you've done none of the reentry process, you've done none of the things that they want me to do, a specs exam, reentry process, anything. And this was, a while ago. And, he said that they weren't going to approve a license until I done some work.
Okay, so you did reapply and they denied your application. Is that correct?
Yes.
Okay, has your wife applied for a license in Mississippi?
Not yet.
Thank you.
Thank you. Doctor, I just had another question, Dr. Stokes. Were you ever able to get your DEA registration back?
Well, I can't apply for one until I have a job position to tie it to. So I haven't made application for a DEA license until I have a job to tie the license to.
Okay, thank you.
Well, I have one more.
Dr. Owens?
Yeah, well, I'm sorry. I did have one more thing. I just overlooked it. You've been involved in observerships and have done like multiple reentry programs, and we've seen documentation of some of the things that you've done. And I guess, so I understand that you did the clinical skills examination for your licensure in Missouri. I will just say that it's very unique for us to have a potential licensee who, or at least an applicant, who has continuously engaged in reentry type or observership programs. Is there, are those tied to requests or for other applications for licensure, or what exactly is the reason why you've done multiple reentry type programs?
Well, anesthesia is confident based, it's technical, but it's also a lot of intellectual. There's nothing easy and just laissez-faire. It's a serious thing, and I take it seriously. I've needed the training. It's been a while, and um, I've tried to take on the most rigorous reentry that I can. And I went to these places because I've made contact with them over the years, and they're places that all offer different types of reentry. The one in University of Colorado, of course, that's a different setting than the one at Mount Sinai. Piedmont Hospital is more like the type of practice that I probably end up practicing in my life. So each one serves a different purpose and prepares me to practice independently, with confidence, and to know exactly what I'm doing no matter where I end up. Um, and of course, um, I've always enjoyed teaching, working with a group, but that's why. No, it hasn't been tied to any particular licensing agency. It's been more independent.
Thank you.
And Dr. Stokes, you said that you have an unrestricted license in Missouri. Is that correct?
Yes.
And have you practiced in Missouri?
No, no, it's been difficult to find a job where I can just work 2 weeks or a week and then come right back to Georgia. Um, that's been difficult. And plus we aren't going to be moving there now. We don't have anyone else living there now. My uncle passed in 2025. So we aren't going to be relocating to Missouri. We don't have anyone else there.
So when did you get the Missouri license?
I think it was in, I can give you the exact date. It was in, it was in, I think the spring of 2025.
Okay. And what other states are you licensed in?
Just Missouri.
Missouri.
Just
Okay.
Missouri. I made application here. Um, I made application here, I think, right after my uncle got sick. I think I made application here. It's been some time, but I applied to Missouri, then I applied to Mississippi shortly after.
So your only license is in Missouri.
Yes.
Okay. Okay. Thank
My
you.
only license is in Missouri.
Sorry.
You had the Georgia left.
Oh, I'm sorry. I thought you mentioned working in Tennessee at some point, but no. Right. Okay. Okay. And that's all. Thank you. Do we have any further questions, Dr. Owens?
I move to close the meeting to determine whether to go into executive session.
Excuse me, Dr.
Second.
Mr. Barnes.
Could I ask the witness a couple of questions? Or you've already moved to close the session, so.
Well, we have a motion. Sorry, we have a question for our attorney. Oh, we have, well, the chair recognizes Mr. Barnes, our attorney.
Thank you, Mr. President. Dr. Stokes, looking back at the history of your conviction, it was related to your practice of pain management, correct?
That's right.
And you were originally charged with 22 counts related to the unlawful distribution of controlled substances. But eventually you pled guilty. You accepted a plea deal where you pled guilty to 1 count of conspiracy to distribute controlled substances. Is it correct?
Yes, that's right.
But it is apparent from the other charges that the federal authorities dropped in the plea deal, such as maintaining a place for distribution of illegal distribution of controlled substances, that they believed you to be running what is colloquially known as a pill mill, correct?
Yes. Yes.
And again, the state of Georgia declined to reinstate your license in 2023. Is that correct?
Yes.
And I'd just like to point out to the members of the committee that the issues, obviously with this long of an absence from practice, there are, issues about technical skills, et cetera. As Dr. Stokes said, anesthesiology is a very technical profession. But in the CPAP assessment that Missouri required, it states a limitation that says the assessment is not designed to provide an in-depth evaluation of fraudulent or unethical practice patterns, inappropriate behavior with patients, or the patient's boundaries with patients. And so, Doctor, my question is simply, why should the board, the members of the committee, trust that you are not going to return to pain management if you get an unrestricted license or, you know, other activities which you would be authorized to do if you received an unrestricted license?
Yeah, so I have 0% likelihood of returning to pain management as a specialty.
Thank you.
And
Okay, thank you. Thank you, Dr. Stokes. We have a motion to close the meeting. Do we have a second?
Second.
Have a motion and a second. All in favor? The meeting is session. And I will ask our secretary, Dr. Givens, to report the committee's decision.
Yes, sir. Thank you, Dr. Chairman. In the matter of Oscar James Stokes, the committee has met and has elected to grant a license subject to completion of CPEP reentry program. So he's to see the executive director for further details.
Okay. I'll get some sausage biscuit, bacon biscuit. You can never go wrong with that.
I'm sorry. Anyway, thank you, Dr. Stokes. If you have any questions, contact our executive director next week. Next item on our agenda is it's a request for an exception to the 20, 80, and 75-mile rules from Dr. Amisha. Excuse me, Dr. Chhipwadia. How do you pronounce your name, please?
That's it. It's perfect.
Thank you, Dr. Chhipwadia. Could you please tell us how you hope we might be able to help you this morning?
Oh, absolutely. Thank you so much for your time. So I am a family physician, and in telemedicine, I am a supervising physician for Molina Care Connections, and I supervise a team of nurse practitioners who practice via telemedicine and in-home visits, conducting pediatric and adult annual wellness visits, in addition to post-discharge care of our Molina patients and members. And I am based in California, and we would like to actually expand in Mississippi and ensure that, you know, the patients, our Molina patients in Mississippi, have access to care. So really that's the you know, crux of what we're requesting.
Okay. I'm not extremely familiar with is Molina, is that operating in multiple? I know Molina is the Medicaid here in Mississippi, right? And how many
It's one of the largest FQHCs in the country.
how many states does Molina operate in?
20 plus states. So I have Dr. Fields here, who is our National Medical Director of Care Connections as well. So he can also answer some of these questions.
Okay, but let me just ask you, how many states are you supervising nurse practitioners in?
In 4 currently.
How many?
4.
4 states. And how many nurse practitioners do you supervise?
I supervise approximately 12 nurse practitioners in these various states. Some are overlapping and some are exclusively to a particular state.
Do these 4 states, do they require physician collaboration?
Yes. Well, Kentucky possibly not. But in California, yes, I'm also in Florida and in Texas. So Texas and California are quite strict. So there I do have requirements, and then Kentucky is
Okay.
perhaps an independent state.
And do you work with nurse practitioners in other states that are do not require physician collaboration?
With Molina requires all nurse practitioners to actually have a supervising physician to ensure quality of care.
Whether the state law requires it or not.
Yes.
Okay. So you are not currently practicing in Mississippi, is that correct?
Do practice. So I do have an outside telemedicine practice where I actually do support patients in Mississippi myself.
With Molina?
Not with Molina, with another telemedicine practice. So with Molina, my role is strictly as a supervising physician because our care connections providers are 100% nurse practitioners.
So you have a Mississippi license.
I do. I've had a license in Mississippi for 10 years now, since 2016.
And you said that you're based in California. Is that where you live?
Yes, I am
You live in
currently.
California. And we've got you're requesting exceptions for these 7 nurse practitioners.
Correct. And they conduct telehealth visits in addition to in-home visits in Mississippi. So there's kind of a mix of it depending on volume and demand and need.
Do you know if any of these nurse practitioners are currently working in Mississippi?
Not under, no. So the providers who will be under my care are currently not seeing patients in Mississippi. We're waiting for approval from the board to move forward.
Okay. And do any of these nurse practitioners live in Mississippi?
I believe some do. So the ones who will be conducting in-person visits, obviously they live in Mississippi. And then we have some cross coverage for providers who are in other states. So our nurse practitioners are licensed in multiple states. So depending on availability and demand, if we have someone who's actually located in Mississippi available to see a patient, they will actually prioritize the in-person visit. When we don't have that availability, then we have providers in other states who actually cross cover. So some of those providers in Mississippi will be potentially located outside of Mississippi.
Have you had a chance to get to know any of the Molina people here in Mississippi?
I haven't met them yet because we are waiting to have approval from the board, basically. So we haven't actually moved forward with our first meet and greet. So that will be scheduled, and we hold monthly meetings to get to know our provider workforce, questions and answers, basically, and then just addressing any sort of questions or issues that relate to the care that they're providing to patients.
Thanks, Dr. Chhipwadia. We have any questions from members of the committee? Dr. Owens has a question.
Hi, Dr. Chhipwadia. Thanks for your time today. Are you involved in any like direct patient care at this point that's not telehealth? Do you do any in-person patient care?
No, I have been a telehealth provider for 10 years now.
Okay, so the last time that you actually provided in-person care was 10 years ago?
Yes.
And you are family medicine?
Correct. Board certified family medicine.
And do you know how many advanced practice providers or APRNs do you currently supervise?
I supervise approximately 20 providers, so 12 with Molina, and then I have a few outside providers as well with another practice.
And have you familiarized yourself with the rules and regs that govern collaborative practice within Mississippi? It can vary from state to state. And have you familiarized yourself with those responsibilities?
Yes, absolutely. And in general, no matter where I'm supervising mid-level or APP providers, I am going to ensure that I ensure the highest quality, of reviews. We do a minimum of 10% in addition to being available via telephone and email for any questions. And in addition to that, Molina especially has a leadership structure where our providers can actually reach out to anyone for help at any time of the day.
And for your telehealth protocols, are you doing synchronous or asynchronous visits?
So for Molina, they are synchronous, and then the visits that I do for my full-time position, those are asynchronous, but also has some synchronous as well. So it's a mix.
Thank you. That's all I have.
Do you have any questions, Dr. Givens?
No, sir, no.
Okay. Dr. Cleveland. Thanks, Michelle.
Good morning. My name's Ken Cleveland. I'm the executive director here at the medical board. You mentioned that you believe that at least some of these nurse practitioners lived here in Mississippi. Is that correct?
Yes.
Okay, so we actually looked up the nurse practitioners that are on your application. And I'm just wondering how familiar you are with the nurse practitioners that you're going to be collaborating with.
I haven't met them yet, so they will be, we were waiting for the approval from the board before we move forward with the next step in meeting them, learning more about them. In general, like I said, the practice is a hybrid practice, so telehealth and in person. So although it's possible that some of these nurse practitioners aren't located in Mississippi, others will be, and the team tends to change depending on who is actually located in that state.
So I'm just kind of curious, and I think that in your practice plan that maybe the plan is to expand the number of nurse practitioners and at that point include some that live here in Mississippi, because based on our research, none of the nurse practitioners that you listed actually have an address here in Mississippi.
Yeah, and that is possible. And yes, it really just depends on the workforce. So who is available at the time, who is located in Mississippi. So it really just depends on the providers, because Molina is such a large organization and nationwide. The availability of providers in a particular state will depend on the applicants that are available.
Okay. So I have no other questions.
Dr. Fields, did you want to add anything?
Hi, this is Dr. George Fields. May I make a comment or two? Give some insight?
Yes, if you can keep it brief, please.
Yes, sir. Thank you for allowing Dr. Chhipwadia and I to meet with you. We currently have 13 nurse practitioners within the state of Mississippi. We cover 116,000 Medicaid lives with Molina in the state of Mississippi. 98% of those, greater than 98%, are Medicaid. A little over 1% are Medicare and Marketplace. We very much serve the underserved. We very much have a very robust teaching, training, auditing team supporting the 13 nurse practitioners within the state of Mississippi. We had 4 supervising physicians. 2, one just retired and one just moved on to another position. So we only have 2 supervising physicians in the state of Mississippi currently, and they're covering our 13 nurse practitioners. We're very much hoping that we can expand the ability for that 75-mile radius within the state for the supervising physicians within the state. We have 2 more supervising physicians coming on that live in the state of Mississippi, but we also are leaving a lot on the table in terms of not being able to fully utilize our nurse practitioners that live within the state or the nurse practitioners that are cross-licensed. And Dr. Chhipwadia would be supporting those cross-licensed nurse practitioners. Our immunization rates are significantly down in the state of Mississippi, and we know that when we visit one of our dear enrolled lives, we literally double the immunization completion rate over time. And I could give you many, many stories to support the kind of work that we're doing. This is not an in-home assessment that is for coding purposes. This is for direct patient care that's supporting the lives of the Mississippians we get to take care of.
Thank you, Dr. Fields. Do we have any other questions or debate from the committee? Do we have a
Move to close the meeting to consider whether to go into executive session.
Second.
all in favor say aye. Aye.
Aye.
Meeting is closed to consider this request. Committee is back in open session, and I'll ask Dr. Givens, our secretary, to give a report on our committee's decision.
Yes, sir. Executive committee has met regarding the request for exemption to the 20, 80, and 75-mile rule. That request is denied. You can contact the executive director for any further details.
Thank you.
Thank you.
And thank you, Dr. Field. Thank you, Dr. Chhipwadia. And the next item on our agenda is request from Dr. Jarrod Marks. Is Dr. Marks, are you there?
Yes, good morning.
Good morning, Dr. Marks. Could you please?
Thank you.
Yeah, please just tell us how you hope we might be able to help you today.
Yes, thank you all. And before I start, I just want to state that Dr. Thomas Recor, who's the clinical director of the Mississippi State Hospital and also the medical director of the Mississippi Department of Mental Health, is on with us in support in case he'd like to say anything as well after. But briefly, I'm a board certified general and forensic psychiatrist, and I reside in New York State. And I was recruited by Dr. Recor and Mississippi State Hospital to assist on the maximum security forensic unit, building 63 at Mississippi State Hospital. And I was down in Mississippi. I'm fully licensed in Mississippi, was down there for orientation and training. And the plan is for me to work as co-attendings with Dr. Frank Perkins, who's also a forensic psychiatrist, and we actually trained together in New York for forensic fellowship. And so we are co-attendings on the forensic unit, and we attend meetings together every day. We do treatment team together. There are two very highly qualified nurse practitioners that work on that unit with us. They both reside fully in Mississippi. They're both full-time in person, and so is Dr. Perkins. And so I'm requesting an exemption to the 2080 rule so that along with Dr. Perkins, I would be a backup to his collaboration with the NPs, because we both participate in teaching the nurse practitioners and supervising and assisting in treatment.
Thank you, Dr. Marks. Do we have any questions from the executive committee?
Just for clarification, your request is just to be able to serve as the backup physician?
That's correct.
Okay, thank you.
Do you have any questions, Dr. Givens?
No, sir, I don't. Thank you.
Okay. Thank you, Dr. Marks. Dr. Recor, do you have anything you'd like to add?
Can you all hear me?
Yes, I can hear you.
Super. My apologies. I'm returning from the coast visiting my dad with my brother. So the reason I joined today is because I intend with your
I'm sorry.
continue to
I'm sorry. You're
try to
you're breaking up.
recruit that are highly qualified, highly accountable. How are we doing now?
Better. Thank you. I was going to say maybe if you cut your video,
Okay.
it might work better. Good job.
Yes, thank you all. So I just wanted to, the reason I joined today is because I'm intending to continue to recruit highly accountable, competent folks, and some of them may be, especially for the more scarce specialties, some of them may end up being out of state. So you may end up seeing folks like Jarrod, especially in the domain of child and adolescent psychiatry. If I'm able to get people to agree to work in Mississippi, collaborating with other psychiatrists that I have come to know and trust, then there may be more like him that we ask to allow to get licenses to work with nurse practitioners, to see patients via telemedicine. But all of this would be done under the umbrella of the Department of Mental Health and Mississippi State Hospital and supervised by me. So that's all I wanted to add to Jarrod's perfect remarks.
Thank you, Dr. Rico. I just like to. I'm Ken Lippincott. I'm a psychiatrist up in Tupelo, but I just like to ask, how many patients or residents do you have at the forensic unit?
Yes, sir. So it's 72 beds currently on the forensic unit. These are folks who are currently charged with felony level offenses and are being restored to competency. And occasionally a civilly committed person who is exceptionally violent will get moved to the forensic unit because we have processes by which we can de-escalate violent behaviors and mitigate some of those. We also have particularly skilled clinicians there. But beyond just the maximum security beds there, we've expanded forensic services, and we're opening another medium security unit in April out at Mississippi State Hospital. And we've converted some of the units at East to intermediate levels of care. So another 50 or so beds for men and 30 for women at East, and that's just because, frankly, we have seen the model of psychiatry in which the expectation is that we get people out immediately and return to the community. You know, maybe on the 110th admission in the last 5 years to a crisis center or the state hospital, maybe someone needs a more carefully thought out discharge plan. So we've been building out DMH supervised group homes, DMH supervised intermediate units, and hopefully with expertise like Jarrod's, we can continue to expand on that. So I think you asked one question and I answered 7, so I'll do better in the future.
Yeah, what's the length of stay there at the forensic unit?
It's an average. That's a great question. It's an average of about 6 months, and I'd say 4 to 6 months, and it previously was longer. But the reason they're committed there, probably 90% of them, the reason they're committed there is for competency restoration. So they're being admitted to be treated so that they can be restored to competency, so they can face their legal charges. And then if they're not restored to competency on an extremely high risk charge, like let's say it's a murder, then sometimes they'll need to continue to be on maximum security, especially if it's, you know, a particularly heinous something that happened. We've had one county request that a person who had an extremely violent murder of a police officer notified. And that's not to say he'll need to be there forever, but his length of stay has been 2 or 3 years there. And so for the particularly high risk offenses, some folks will stay longer, but an average of 4 to 6 months.
Thanks, Dr. Rico. And the forensic unit, building 63, that's at Whitfield, right?
Yes, sir. I would invite any members of the board who are interested, if you ever have an opportunity to come by, I would love to show you the building. It is a national treasure at this point. I mean, really, of all the forensic units I've been on, it's so impressive. And the culture there is exactly what I'm wanting. And I really think, I mean, I'm not being hyperbolic here. I think we can set a national standard in public mental health care with the current facilities and the team we've recruited. So I would love to show it to you.
Okay, well, thank you very much. Any further questions or discussion from the committee?
None from me, sir.
We have a motion.
Move to approve the request.
We have a motion. We have a second.
Well, since I was beat, I'll second it.
Thank you. We have a motion and a second. Any further discussion or debate? All in favor, say aye.
Aye.
Aye. The motion carries to approve the request for the exception to the 75-mile rule. And thank you, Dr. Marks. Thank you, Dr. Recor.
Thank you so much.
Yeah.
Okay. Yes, thank you very much.
Thank you all.
Is there any, we have another item 5 on the agenda is a report from our executive director.
I'm going to be shooting from the hip a little bit here because I printed it out and then left it on the printer. But So the usual things that y'all hear me say, continue to meet with the other directors of the healthcare boards, continue to meet with our physicians health program on a regular basis, continue to meet with licensees over just minor transgressions and try to correct their behavior in a non-public way. And then other than that, we've been preparing for the move. So I don't know if y'all have been nostalgic about today's executive committee meeting, but this is the last one we'll have in this room. And same will go for the board meeting when we have it shortly. So that's it.
Thank you, Dr. Cleveland. Is there any other business for the executive committee today? If not, the executive committee is adjourned.
Full board meeting at 10:30.